Do you have low back pain that just never seems to go away? Sometimes it'll dissipate for a few days, but then it'll come right back again. And it's dull and achy pain, it's diffuse across the low back, and sometimes it'll be so intense, it'll actually radiate into your hips. Well, it's quite possible you have something called Lumbar Facet Syndrome. Hi, it's Dr. Lorendi with the Center for Health and Longevity. I'm in my Santa Monica office today, and I wanted to take time and talk about one of the most common causes of mechanical low back pain, and that's facet syndrome. Now, lumbar facet syndrome is generally characterized as dull, achy, diffuse low back pain. It's usually periodic in nature, it comes and goes, but sometimes it can become chronic, and it can become more intense, and actually can radiate pain into the sacrum and into your hips. Well, let's first understand what a facet is. So a facet is a joint, and specifically it's a synovial joint. So where the two parts come together, the two parts of the joint come together, there's actually articular cartilage, there's a capsule to it, and there's fluid inside of it, very similar to the knee, but much, much smaller. And in fact, you have pairs of these facets at every level of your spine. So your neck, your mid-back, your low back, you have pairs of these facet joints. And specifically in the lumbar spine, or the low back, these facet joints actually aid in flexion and extension. They're there for stability and they're there for flexibility. So what are the symptoms? Well, with facet-related issues or facet syndrome, you're dealing with dull, achy, low back pain. Now that pain could radiate around the sides of the back, it could radiate maybe into the sacrum or the hip area, but that's one of the distinguishing features of facet issues or facet syndrome is this kind of local pain, local to the low back. And that's one of the differences between facet-related issues and, let's say, disc-related issues is the pain pattern. So if you've got pain running down the back of your leg and into your foot, that's not facet-related, that's disc-related or something else. Now maybe in some late-stage osteoarthritis or you've got severe degenerative changes in the facet, could you have that kind of pain pattern? Sure, but you're going to have other things going on as well. You're probably going to have disc-related issues and so on. So facet-related issues or facet syndrome is usually local to the low back. Now you can actually test to see if you have this by leaning back. So if you hyperextend your back, if you lean back, you're going to actually press those facets together. So if you think of the anatomy, those facet joints are starting to press together. You're increasing pressure within that joint and you're causing pain. And by the same token, if you lean forward, you'll tend to alleviate that pain because you're doing what? You're taking the pressure off the joint and you're increasing space within that joint. So leaning back will cause you pain and leaning forward will take the pain away. So what are the causes? What creates facet syndrome or facet-related issues? Well, let's take major trauma and accidents out of the way for a second. So you didn't get hit by a bus, you didn't get into a car accident, you didn't fall off a ladder. Okay, just put that to the side. I would take the rest of it and put it into three big buckets. The first is flexibility and mobility. Now, if you think about it, 10,000 years ago, we were either running after something we wanted to eat or running away from something that wanted to eat us. So we were moving our ankles and our knees and our hips and our low back and our shoulders, and everything was moving all the time. Right? We had constant mobility and flexibility because we were climbing trees, we're very, very active. We just don't have that anymore in our lives, right? We're sitting in traffic to and from work an hour each way. We're sitting at a desk at work maybe, or sitting in a work-related situation at home, and maybe there's poor ergonomics, and you're sitting in a crummy chair at the dining room table, and you're just not in a comfortable position, and you're compromised, right? And maybe you're not exercising enough, or you're just doing certain things, like you just go to the gym and lift a certain bench press and a few other things, or you're doing very, very specific types of sports that don't move all the joints in your body. So what happens? Well, those joint capsules, the joint capsule, the ligaments, the tendons, the muscles, they tend to hyper-shorten. And if you think about it, you got those little facets, those little facet joints, and you have a pair at every level of your spine, and those are not getting enough movement, right? Maybe you're moving your knees and your hips and your shoulders a lot, right, doing bench press, but you're not moving the other joints in your body. So you're kind of picking and choosing what you're going to move. The second one is going to be two parts. The first part is going to be core strength or abdominal strength, right? The second is going to be weight gain or excess weight. And let me illustrate that with a story. So Many years ago, I was at a seminar, and the guy who was giving the seminar, I think, average weight, maybe 175 pounds, give or take. He had a Coke can, he had a soda can, and it was full and opened, and he put it on the ground, he set it on the ground, and then he stood on it with one foot. So he's kind of balancing his weight, standing on this Coke can, and it didn't burst, it didn't leak, nothing happened, right? Just supported his weight. And then he took the Coke, he stepped off it, took the Coke can, and opened it, poured the contents out, put the empty can back on the ground, and tried to do the same thing, stand on it, didn't jump on it or anything, just stood on it, same thing, and it collapsed. And what he was trying to illustrate is the Coke can under pressure will hold a lot of weight, and the analogy is your abdomen is sort of like the Coke can, right? You've got the abdominal wall that surrounds your entire abdomen, you've got the back muscles, you've got the lumbar spine, and that whole thing, right? That whole complex is holding up your body. It's separating your upper body and your lower body, right? So if you have a strong core along with those other components, you can carry a lot of weight, you can support a lot of things. Now, if you add to that, let's say 40, 50 pounds of excess weight. I'm not talking about 5, 10 pounds. I'm talking about 40, 50, 60 pounds of weight. If you have that excess weight, well, what's happening? You're adding pressure to that lumbar spine. You're adding pressure to those facet syndrome, to those facets. That leads to facet issues. It leads to other issues, by the way, disc issues and so on, but save that for another video. Add to that the way you distribute weight. So women tend to distribute weight a little more evenly than men, okay? So if you're a guy, and most guys, we carry our weight in our bellies, right? So if you have a lot of abdominal weight, a couple of things are happening. A, you've got a lot of weight on. B, the center of gravity has changed. So now maybe the hips are flexing forward a little more because there's that abdominal weight. Also, that abdominal weight is pulling you forward. You're then counterbalancing with your upper back and neck to sort of straighten up. What's happening to that lumbar spine? It's increasing its curve. It's becoming hyperlordotic. What's happening in those facets? You're jamming the heck out of those facets, right? So that's a problem. The third, in my opinion, would be microtrauma. Now, microtrauma can come in a lot of different flavors. So it could be work-related microtrauma. Maybe you have a job that has a lot of repetitive stress in it. And that repetitive stress is microtrauma, and that microtrauma is impacting the facets and probably other joints in your body, but it's impacting those facets and it's creating this facet syndrome. Maybe you play a sport that is very selective or tends to stress one joint over another, right? There's certain sports that have very specific patterns to them. And maybe that sport or that activity is creating facet syndrome. It's impacting those facets. So microtrauma is definitely one of the third buckets, right? Now there's other things. One that comes to mind is diet. Maybe you have a poor diet. There is an argument around increased inflammatory agents or systemic inflammation within the body. But outside of that, I would really stick to those big three, right? The flexibility and the mobility, the significant weight gain, the abdominal core strength, and microtrauma, which is habits. And that could also lead to maybe poor posture, and poor posture will tend to reinforce all that stuff. So what are some of the solutions and treatment options available? Well, the first thing we need to do is figure out where you are in the process. So if you're at the very beginning to middle stages of lumbar facet syndrome, it's very important that we work on flexibility, range of motion, and decreased inflammation. Now we have a table in the office. It's a very specialized table. It's called a flexion distraction table, and it's very, very good at working on the low back and specifically the lumbar facet joints. Now, although it's good to work on the low back, that seems to be our focus, it's also important to look at the larger picture. So we need to work on the ligaments, tendons, muscles, and joints in the mid-back, as well as the low back, the hips, and the legs, so that we work on overall flexibility, because nothing lives in isolation. We don't want to have a myopic view of the low back. We want to have a broader view. So what if it's microtrauma and repetitive stress related? Now, a lot of us think of repetitive stress injuries as work-related. Carpal tunnel is an example, using a mouse. Or you use a lot of heavy machinery, jackhammers, heavy power tools, and you have upper neck and back issues and low back issues. It's not always work-related. Sometimes it can also be sports-related. There's many sports that are very repetitive in their motion. It's the same motion over and over again, thousands of times a week or month. And it's important to isolate that, understand it, and then come up with something that's counterbalanced, or that will counterbalance that. So another sport or some other kind of activity. It could be weight related. Now, I talked about this earlier, carrying 30, 40, 50 pounds of excess weight. It can change the center of mass and the center of gravity, and that can cause a strain on the lumbar spine, increase the curvature of the lumbar spine, and actually force those facet joints together and have them start to imbricate or start to press together, and that causes pain. I can't say this enough, and I can't stress this enough. It's important to get on these things early. Don't think that, well, you know, I'm in my 40s, I'm supposed to have back pain, or my dad always had back pain, so I'm supposed to have it. If you've got chronic or even periodic low back pain, you need to see somebody. You need to get treated. Whether it's myself or somebody else, you need to get treated. You need to get it resolved, and you don't want to have that in your life. So it's very, very important that you take it seriously and get seen by somebody and get it properly treated. Well, I really hope you enjoyed this video and got a lot out of it. If you have any questions or concerns, please don't hesitate to call me or reach out by email. I'm more than happy to talk to you. And I hope you're doing well, and I'll speak to you soon.